Hello, this is Dr. Karen Radley, family physician in St. George, Utah, and today I wanted to talk to you specifically about a principle of medicine, and that is bending the cost curve. So we've gone through a lot of healthcare reforms recently, from the PPACA or Obamacare to most recently in 2016, MACRA law requiring a reporting on MIPS. Prior to that, we had the MCMP, PQRS or PQRI, meaningful use, and some of that is still ongoing. There's always different regulations out there. Why? Why are these regulations being done in the healthcare system by the federal government in intervening or, basically messing with what we're required to do as providers? Well, you have to take a look at the overall picture as to where we're going as a country. So the U.S. healthcare spending alone for 2016 grew 4.3%. So that's after the PPACA was enacted or Obamacare. It continues to grow. In 2016, it reached $3.3 trillion, or an average of $10,348 per person in the United States. The biggest concern is as a share of our nation's gross domestic product, meaning how many dollars do we take in as a country that we spend on our nation here domestically, not overseas, not foreign, but here domestically. How much of that is spent on healthcare? 17.9% of our gross domestic product is spent on healthcare. Almost 1/5 of everything. That's military spending, federal programs for resources like food stamps, roadways. I mean, anything that the federal government spends $1 on is counted in that if it's done here domestically, here in our physical nation. 1/5 is being spent on healthcare. And something has to change. We can't continue to go on the trajectory that we are currently on. So I'm going to put up here a screenshot that was taken from Centers of Medicaid and Medicare Services that shows the growth over time of consumption of gross domestic product of healthcare dollars. And you will see that slope of the curve is continuing to grow and rapidly growing. And it's estimated that it's going to continue to grow to where it's over 1/4 of our GDP and projecting it to even reach even 1/2 of our GDP if we continue at the rate that we are, specifically based off certain conditions that we are not seeing a significant improvement in, such as like diabetes. So if you look at some of the regulations that have been implemented in the last several years from different governments, meaning the Obama administration, the Trump administration, they have a goal in mind. And so let's start with Obamacare. The Patient Protection and Affordable Care Act is what it's officially titled. Implemented on March 23rd, 2010, 906 pages of new legislation. But really, what was the 10,000-foot view or overall goals of this healthcare reform or regulation? Number one, bend the cost curve of healthcare. So we have to reduce how much we're spending on healthcare, and specifically in relation to the GDP. Number two, ideally they wanted to insure everybody. The way that was to be done was, quote, making accessible insurance, even if it was through government subsidies. But the idea was to insure everybody. And number three, protect patients against arbitrary actions by insurance companies, so stop the abuses. So really the biggest two parts of the goals were the first two, bend this cost curve and insure everybody. Well, are we really meeting the goals? I mean, that's something that you as an individual can do some research on and take a look and see what you think. But I can tell you, if you look at the graph that I presented, our GDP isn't changing. Our percentage of GDP consumption isn't changing, it's increasing. So we haven't really bent the cost curve. And we know that there were over 40 million people in our country that were still left uninsured. So of the 330 million people roughly estimated in our country, 40 million were still uninsured. That's still roughly, about 10%, a little more than 10%? So we really didn't achieve the goals of this drastic healthcare reform that was implemented in our country. If you read the literature behind the agenda, it is claimed that the United States spends far more on healthcare than any other industrialized nation, and the quality of healthcare is often much worse. Many will debate that last tenet, the quality. I'm not going to get into that right now. I'm going to let you do the research and decide for yourself, but that is something that is still behind ongoing healthcare reform, and it's something that the government is still going to continue to push until they feel like we have met the quality. So that's something that you need to be aware of and be thinking about. So how do we bend the cost of healthcare? This is something that I wanted to bring up because this is continuing to be put back onto providers more and more. And there are things that we can do in the healthcare arena as providers and healthcare systems. So number one, we can reduce costs through transparency. If we make you as a patient, a consumer, and make you savvy to the dollars that you spend, you're going to shop around. And when you shop around, you're going to look for a couple things. You're going to look for high quality and good value. So not necessarily always going to be the bottom dollar cost, but you're going to look for, getting the biggest bang for your buck. And through transparency, through publishing of quality that's being offered by providers or health systems and by their direct costs, that will continue to shift that curve. It's not being fully embraced yet to this point, but you are starting to see inroads into that. The next is reducing consumption of care. We need to educate patients on what is the appropriate avenue to seek the care that they need at that time. Just because you have a cough doesn't mean you have to go to the emergency room. Can you wait a couple of days and get into your primary care provider's office? Can you go to an instant care or urgent care clinic? Utilization of resources and the most appropriate way to use those resources is a very important way of reducing costs. Emergency care, ER care is expensive care, and we need to be better consumers of recognizing that and seeking care where it really is most appropriate, but also working as clinicians in our private practices to be accessible when we need to be, or ways to try to help that as much as possible. Unfortunately, as a single provider, I can't do everything all the time, but we can try to work with the system to make it the best that it can be. Reduce waste, fraud, and abuse. So many times patients will have studies ordered or labs ordered by one provider, and then they'll go to a different provider and be seen, and rather than take the time to look up what was previously done, because let's just face it, it takes a little bit of time in your clinic, and hopefully I'm not going to say it's because you're too lazy to do so, but I'm going to assume it's because you don't have access, but we just repeat the tests. I mean, really, is that always necessary? Can we not look for the studies that were already done and spend a little bit more time in trying to capture that data if we need to, and then proceed forward with a plan based off of what we already have in hand versus just automatically reordering tests and duplicating costs? Fraud. So much fraud still goes on in people trying to bilk Medicare or insurance companies for money. There's sham corporations and medical supply companies and other ways to do that, and I'm not going to go into that, but it still is ongoing and continues to be targeted to try to reduce costs. And abuse. How many times do you hear someone say, well, I've met my deductible for the year, so let me get everything done. Well, do you really need everything done? Can we be a little more conscientious about what we're doing and why, and understanding the appropriate use of resources at that point? Improving quality and improving health. So this is where providers get targeted on an ongoing basis. If we can capture disease processes early on, and we can improve outcomes on those disease processes, they won't go on to advanced states, which we know cost more care. So part of that is improving access. And the claim is that if you can get patients in to see a provider at a sooner time frame in their disease process, they won't let it linger and it won't be as advanced by the time they actually have that captured. And if that's the case, then it won't be as a higher dollar consumption of care. Not always true, but that is the theory. If we can prevent people from having delays in seeking health care, they won't be as sick. But again, the majority of this is being put on the provider to meet up with that quality expectation to try to reduce the costs. The area that's being missed is, what about the patient? I can talk to a patient till I'm blue in the face about medications, lifestyle changes, etc., and sometimes it doesn't make any difference. The patient doesn't buy in, they don't care, they don't want to, they don't want to listen to it. Sometimes it might be lack of resources on the patient's part. Can we find ways to work around that? But unless the patient has that direct buy-in and they understand the how and the why and they're doing their part as well, there sometimes isn't a whole lot I can do as a provider that's going to make a difference. I can continue to encourage and counsel, etc., and I can do what I can, but sometimes the onus is eventually going to have to be taken on by the patient. They're going to have to own that. They're going to have to take responsibility for that, and until that happens, we may not make a difference. So that is something that needs to continue to be looked at, but right now really isn't weighted very heavily. So how does the government continue to push the bend the cost curve? Increasing regulations and demanding compliance. I mean, there's program after program that has been passed through the legislation process to mandate more of us as providers. And there's a huge degree of provider burnout right now because of this exact thing. And we already know that we're going to have a healthcare shortage of primary providers in this country as it is because of the increase of access to care and because of the baby boomer population aging and needing more of the resources of time. But if we have physicians or providers exiting healthcare because of burnout, that's not going to help the situation either. The government uses the carrot or the stick. Either they're going to reward you for being an awesome provider and providing great quality, or they're going to beat you into submission financially by taking resources away from you. I don't know that either of those approaches is really great, but that's what's going on. Again, holding providers accountable for quality and cost of care. I'll be the first one to tell you, we can always do better. I can always do better. I think I do a great job at really focusing on this and trying to do the best I can, but I always know I can always do better. I can always try to take it to the next level, but I'm motivated to do so. Not all providers see that the same way. They're doing what they need to, but are they taking it to that next level? So again, what is missing? Patient buy-in and responsibility. And I tell patients all the time, well, why should you care? What does this matter to you that this is going on in healthcare? Well, if you watched what happened in PPACA legislation going through or Obamacare, you heard about certain rights or leeways in medicine and receiving healthcare that were being taken away that might be circumvented as access to you in specific arenas. For example, if you are an elderly patient, you probably aren't going to have access to dialysis, or there might be a cutoff on $1 million newborn ICU babies. I mean, there's a way that eventually the government is going to say we can't afford to keep paying these exorbitant amount of dollars on this small number of human resources, and we're going to find the biggest way to focus our dollars on the biggest part of the population. One of President Obama's friends and advisors, Ezekiel Emanuel, who worked for the National Institutes of Health, has an entire book focusing on these principles, and you can read it for yourself, but you have to think about what that is being advised in a government level and what that's going to translate and look like eventually. So do the research, look at that for yourself, make your own conclusions. Why else should you care? Because it creates an antagonistic relationship between you and your provider. If I'm going to be held financially accountable for the quality that I provide in my office, but my A1Cs are elevated because the patient isn't doing their part, they're not taking their medications, they're not eating the diet that they're supposed to be doing, they're not doing exercise, there's going to come a point where, as a provider, I'm going to say to you, I can't continue to provide care for you if you don't care. And that's really hard to hear, but I have to keep the doors open. I still have to employ my staff. I still have to run a business to look at the greater good of providing healthcare for the rest of the patients in my panel. And so if you have patients that are costing you because they're not being compliant, or you're having a hard time spending a large amount of resources and trying to get them at the level that they need to be, there will be a point in medicine where providers are going to say, I'm not going to continue to take you on as a patient. I don't think we're there yet, but be aware that I do think that is coming. And then eventually they're going to come for you as a patient as well. So You'll see that right now already with different insurance plans. If you are a smoker, you might be charged more on your insurance premiums. If you've had certain health conditions or heart conditions, you might be charged more on your insurance plans, or diabetics. A lot of insurance plans aren't going across the board and triaging that as such, but what they do is set metrics. So if you come in for your routine health screen with your work, where the insurance company comes in for that visit and they check your blood pressure and your blood pressure is high, they're starting out with the carrot or stick approach. So, hey, if you go to your provider and you can show that you brought your blood pressure down, we're going to give you a $50 voucher for doing that. But eventually they're not going to pay you for that. They'll take it from the carrot and they'll take it to the stick, and it will be, this is going to cost us more as an insurance company, so we're going to make you pay more on your premiums and other things up front. So just be aware that that is coming. I mean, you're seeing some of that already. The fact that insurance plans are already asking you to go and get these preventive medicine things done tells you that they are watching, that they are very aware of this already. So I don't want to sound like I'm bordering on paranoia, but I think as a consumer, as a patient, you need to be informed. You need to be aware of how these regulations are affecting your provider. You need to be aware of what the regulations do in healthcare in general and in the community and in our financial resources and our economy as a government system. And be aware, listen to the media, watch the news, see what's going on, and see if you can extrapolate that data and see how that applies to you individually. So if you have questions, please go on to the website and send me questions. I'd be happy to try and answer them back with other sessions of feedback, or you can post them on Facebook down below or on YouTube, and try to have an ongoing dialogue. I would love your feedback with this as well. So until next time, this is Dr. Radley, family physician in St. George, Utah, and Pura Vida.